So now that we're done all of our prior assessment, so now we're going to move into cranial, so craniosacral. So we're going to do some assessment first. So I'm going to check the quality of your cranial sacral rhythm throughout your body at all the different listening stations. So yeah, we'll proceed with that. And then we're going to do a little bit of treatment afterwards. So just, we went through all the risks and benefits already, but just let me know if there's anything that feels uncomfortable or painful at any time, and then we can have a look at that point. Okay?
Okay.
All right. So now we'll check the dorsal part of your feet. So there, I would say that your left is a little bit better. I would give it a rating of 3 in the square on the left and 2 on the right. Just because the right seems to be a little bit lagging in amplitude. Okay, now we'll check the shins. And the same thing there. On the left, it's a little bit better quality. So the left side, I would give it a 3 and a 2 on the right. Okay? And then this side. So this is for the thighs. Again, I'd have to give this one a 3 on the left, and it's just not quite as strong. So, and the rate almost seems to be a little slower on the right. So a 3 on the left and a 2 on the right. Okay, now we'll move up to the ASIS. So these ones, the amplitude is a little bit lower. The quality seems a little lower too than some of the higher points down on the leg, but very symmetrical. So I'd give this a 2 on each side. Yeah, 2 on the left, 2 on the right. Now let's check the lower ribs. And if I can just get you to just hold your breath for a couple of seconds, just so I can start feeling the rhythm. There we go, you can keep going. And this is very similar to the ASIS. It's very symmetrical, but the quality is kind of lagging a little bit, and the amplitude also. So I'd have to give this a 2 on each side also. Okay, and then we'll check on the shoulders. The shoulders are kind of the same too. So they're both symmetrical, but it seems like in inspiration, there's a little bit of a kind of jerkiness, or just it just doesn't want to move quite as smooth. So I'd have to give this a 2 on each side also. on to our vault holes. Okay, so vault hold 1, just on each side of the ears. And there we go. So now with this vault hold, I'm feeling a nice fluid movement on the right. But almost no movement on the left. You feel that? Feel like there's like more movement on that right side, and then just that left side is just, there's a slight little bit of movement, but it just stops and it pauses till the exhalation cycle comes in, and then it moves a little bit again. So it definitely seems like it's a little stuck right there. So there is movement, so I would probably give the left side a 1. And probably a 2 on the other side. Maybe a 3, but I think I'll go with a 2. Just because I think it could be a little bit better. Okay, then we'll do the vault hold 2. So now we're just looking for that clamshell feel where this one is actually quite good. Felt it right away. And there's quite a bit of movement. And it's nice and fluid. You can tell when it goes to neutral and when it crosses over. Okay, and then we'll move on to vault hold 3. And so we'll give that one a rating of 3 because that was a really good movement. And now we'll move on to vault hold 3. So I'm just going to place my thumbs really lightly on the sphenoid, holding the occiput. I'm having an issue with this one, but just to feel it, but I am actually feeling this one. So what I'm looking for is an inferior and superior motion. And I can definitely feel it moving properly, but it does seem like it stops before it should. After about 3 seconds it stops, and then it just pauses for a little bit longer. So it's like it's not completing its cycle there. But symmetrical, the amplitude is good. So I'd have to give this one a 2 on each side since it is symmetrical. Okay, so knowing that, we'll just take a little pause, and I'm just going to try to find out what my clinical impression is and what we're going to do for treatment, and then I'll be right back. Okay, our clinical impression would be that the cranial bones on the left side are most likely restricted. I would say probably the temporal bone, which that will probably be one of our treatments, probably the focal one. So we're going to start off, well, first of all, the reasoning behind that would be that So based on everything that we've assessed earlier, so there was the one, the accessory nerve that we found a lesion in, and it does run through or would be affected by the temporal bone. So if the temporal bone is restricted, actually probably from her accident in the past also, it would kind of all make sense. And then also contraindication for that would be ligament laxity, which we've done a test earlier, and she didn't have ligament laxity. So yeah, so for the platform no CB, that could be a contraindication. So we're all good for that. So yeah, there is evidence that the cranial bones misalignment can actually affect or alter the TMJ joint, temporomandibular joint. And since you do have problems there, just moving away from cranial, you did have quite a few issues with the fascia, fascial restriction and posture. So chances are that's probably not helping you too, but if we move into the cranial work, hopefully that'll help out. Okay? All right. Okay, so we're gonna start off with CD4. We did work on the CCP when we did the myofascial earlier. Okay, so I'll have this one here. Just slide our hands under. Okay, and just relax. And I'm just going to essentially just do like almost like a volleyball hold using my thenar eminence along the occiput and just assessing square, and I am feeling it more on the right side than the left. It's lagging a little bit on the left also. Everything seems to be on the left. So I'm just going to wait now for expiration. And then I'm just going to hold when it goes back. And then I release. And it's just a slight hold. Almost just holding it into that position. And when I released, I definitely felt more of an even score on each side. Okay. And then we're going to move on to OCB for our local. So the CV4 was our global. And then OCB is going to be the local. So I'm just going to be cradling the occiput, just slightly putting a little extra curl in the tip of my fingers just to slowly sink in. To the tissue. This could take a little bit more time on some people, sometimes a little faster. Yours is starting to move, starting to kind of almost melt a little. Okay, and then we can do our platform. And this again, this is the one that we contraindicated in children under 12 years old, or if you got ligament laxity. And then again with this one, I'm just looking for just the tissue relax. And I can feel just sinking in. You feel that? Mm-hmm. Feels pretty good actually. Mm-hmm. Alright, and now we'll do the other one where I'm just going to hold on to your occiput and use my index fingers to kind of go right up against your spinous process of C2, and then just a gentle a gentle, well, essentially you're doing a traction in between the occiput and the C2. And just waiting for tissue release. There we go. And then we'll finish off the OCB with the spreading at the occiput. And we're just kind of putting a lateral spread. Again, just very gentle. And just letting the tissue stretch, and then you just don't go past the condyles when you're releasing, because you feel the skin just kind of releasing. And I'm not sliding over the skin, but it's just your fascia releasing. And right there. Okay. And then the tissue definitely softened up quite a bit in that area. All right. Okay, so now we're going to do an assessment and a treatment for our focal treatment. So we're going to be checking the temporal bone. So for the assessment, the way you do it is you start off with your middle finger and the external auditory meatus, and then the ring finger goes on the mastoid process, and the index finger goes on the zygomatic process. And now we're just assessing for movement. Actually, quite a bit more movement on the right. There's barely anything on the left. So now what we'll do is we'll do an osseous release. So I'm just going to support the occiput, and then using my index and thumb just at the cartilage of the ear with about 5 grams of pressure. Going to be doing a lateral and posterior tension till I can feel a release. And doing it just on the one side is a focal treatment. If we would be treating both sides, that would be more of a local. And I'm starting to feel it kind of wanting to release. It's almost like pulsating, going and coming back. Just on the one side is a focal treatment. If we would be treating both sides, that would be more of a local. And I'm starting to feel it kind of wanting to release. Okay, did feel a little bit of a release there, but now let's just double check. Doing that assessment again and verify that there's movement on each side. Yeah, I can definitely feel both sides now. So my ring finger on each side Feels like it's moving evenly. Opposed to the index, yeah. Okay. Went from no movement at all to even movement. Okay. How's that feel?
Good.
All right. Okay, so that would conclude our global, local, and focal treatment.